started with a small hard spot and a sensitive feeling under your arm. And before you knew it, your head was in your hands at the doctor's rooms after waiting too long to have it checked out. Does this sound familiar? Could it be your future? At least 1 in 29 women in South Africa will be diagnosed with breast cancer. And it's not just the ladies, 1 in 100 men will also face the same diagnosis.
According to the South African National Cancer Registry, 1 in 29 women in South Africa will be diagnosed with breast cancer. Breast cancer, like other types of cancers, is treatable when detected early. There are 2 ways to examine the breast for breast cancer: mammography and physical examination. It's important for you to examine your breasts regularly.
October is Breast Cancer Awareness Month in South Africa, and helping us out to understand how it impacts our health and future are fitness and wellness expert Lisa Rally, family medicine practitioner Dr. Lerato Masemola, and because I can't be the only thorn among the roses, we also have Dr. Darren Green over here with us today. Welcome to Doctor's Orders, guys.
Thank you.
So let's start with the signs and symptoms of breast cancer.
Well, the commonest symptom of breast cancer is the lump.
Yeah.
You know, a lot of ladies find these before they go to the doctor. In fact, 80% of women will present to the doctor or the healthcare practitioner with the lump before the doctor finds it.
Yes.
And in that breast or in the opposite breast, depending on the presentation of the disease, you may find that there's changes of the skin, which is the color, and also the skin might look more dimpled or puckering, like an orange peel effect.
Yes.
Because maybe the tumor is pulling in from the inside. There might be a discharge coming from the breast with or without a presentation of a lump. There might also be sensitivity or lumps under the arm that one might pick up before they present to the doctor. So those are the commonest symptoms. But breast cancer can also be picked up by a mammogram.
Yes.
So there's no lump that somebody felt before. So there were no symptoms then, and during screening, which is why it's important to screen for these kind of conditions, somebody might find a lump. They can visualize smaller ones with a mammogram.
When do women start screening?
Well, it depends. You know, generally anybody over the age of 35 to 40 should screen at the mammogram. But if you have a family history, it's very important to screen from earlier on. So yes, there are people who are more predisposed to having breast cancer. So the general rule is if your close family member, this will be your mom or dad, because men can get a breast cancer, and your first degree relatives basically have breast cancer, and you also look at the age at which the cancer presented. You know, that will just give you an indication of how your risk is. But yeah, so screening is very important. The most commonest way of screening is a breast exam, which I generally teach, the young girls come into my practice for a flu, and I'll say, hey, do you know how to examine your breast? They're like, what's that? I'm like, you have a mommy?
Yes.
So
a partner breast exam.
Would make more sense. It's a lot more fun.
No, but if it's a teenage girl, they're just starting to discover their bodies, and I always tell them, and even the older ladies, you're the one that knows your body the best. So if you're more aware of what's going on in your body, examining your breast, and I say as a general rule, it's supposed to be more frequent than once a month, but I say you cannot go more than once a month without doing it. And it's something that you do in the bathroom when you go shower or bath. You take off your clothes, you look. Do they look the same? Do they look similar? Because they're never quite the same. Do they look similar? If you're worried that one looks like a grape and the other one looks like a watermelon, something is wrong.
Of course.
Okay. If something looks odd, if it's a bit itchy on the skin, if one's a bit drier than the other one, if there's dimpling or puckering or orange peel effect, if there's anything oozing there, then you have to get it checked out. And the most important thing is if you find something wrong, don't panic. Don't think it's cancer, because there are benign breast tumors as well. And the other opposite is you find something and you panic and you sit at home. A lot of people present late because they're scared it's cancer, and indeed it is cancer, but they present much later when they could have cured it.
But you need to go early also to test yourself as well. And then once they test you, they stage the condition. We'll talk a little bit about staging.
Sure. There are 2 main staging systems that are utilised worldwide. There's a number one, which goes obviously from 0 up to stage 1, 2, and 3. But the one that's most commonly used is called the TNM classification. And TNM obviously stands for the individual words, the tumour itself, or the lump. And that's staged with numbers as well. TX meaning that it cannot be staged. T1 to 4 according to the size of the nodule or the lump. Then the N is for nodes. And everyone knows that cancer of the breast it radiates or metastases to the armpit.
Yeah.
So you have regional lymph nodes that need to be looked at. And then if cancer spreads from there up above the neckline or the collarbone, obviously you move into the next stage of what's called nodal metastases. Yes. The M is that exactly. Metastases. Yes. And that also defines basically with a body chart how far from the original site of the breast cancer it
where
was.
It is.
And the TNM classification is vital. It's very important because we use it in deciding what management the patient needs. And this is based on years of research, evidence-based medicine. So it does determine management.
And in terms from a lifestyle and wellness perspective, Lisa, what's your approach?
There's actually a lot that you can do to help prevent breast cancer and to really reduce your risks. And first and foremost is exercise. That they've proven that exercise helps to inhibit your estrogen production. So, and this is not just strolling around.
Exercise is like
4 hours a week.
For everything.
It is
4 hours.
4 hours a week of exercise, and that will help to reduce your chances by 22%. Yes. So that is definitely significant. Okay, but it's 4 hours, and it needs to be moderate to intense exercise to actually have any kind of value whatsoever. Nope. And when it comes to diet, that is critically important. You can increase all the different varieties of colours of fruits and vegetables, and that's going to expose you to different nutrients. Foods that are high in superfoods and antioxidants, things like green tea, vitamin B is very important. Just to really boost one's immune system. And then alcohol is a big no-no. So, 2 units of alcohol per day can actually increase your chance by 24%. You don't need to be an alcoholic. It's your 2 glasses of wine that you're unwinding at the end of the day. That can increase your chance by 24%. Is it really worth it?
Yeah.
That's what you got to ask yourself.
Darren, men are also affected by breast cancer. What's a good approach to have?
Sure. What they don't realize is they've got the same glandular tissue that women have. Obviously, it just reacts differently in terms of the hormone that is released to activate that tissue.
Yes.
It's not supposed to be functional breast tissue in men. Yeah. But when it is turned on in terms of the gene or in terms of the hormonal imbalance, you will notice budding of the nipple area. So what they call man boobs or moobs or gynecomastia, the right term, needs to be looked out for. And if you do see that developing, it's not only always a result of fat or having an increased metabolic profile. You need to have it examined. So that, as well as we even have had men with discharges from their nipples as well, funny enough. So men should act on masses or swelling around the area or even painful gland tissue.
Breast cancer in men tends to be more aggressive simply because men don't expect themselves to have breast cancer. So by the time they find it, it's too late. And that's the only reason why it's so aggressive, apart from genetics. So it's very important, to know where you come from in terms of your family history, and if you are aware of your body changes, please get it checked out.
And as Lorata said, you've got to know your genetics, but a smaller percentage of breast cancer is caused by genetics than is by lifestyle-related choices.
So that's the most important thing.
That is the most important thing. You are what you eat.
Thank you guys for joining us and sharing your expertise. As many people know, adversity brings us together, and the same can be said for people whose lives have been affected by breast cancer. We take a look at one of those brave organizations working to raise awareness for breast cancer in South Africa.
CancerVive is an organization focused on cancer awareness, but their main event is a 7-day motorcycle ride, bringing help and support to small towns.
After going through cancer, we thought we want to do something that's going to make a difference out there, that can make people aware of early detection and the importance of early detection, because that is key to survival. But we wanted to do it in a wow way. This year we plan to see about 10,000 people at least face to face to make them aware of the early signs of cancer. But when we get to those communities, we always try and find somebody in the community who's willing to be trained as a cancer buddy. So when we leave and there's somebody who needs help or needs support or needs advice, that there will be a trained cancer buddy that can actually support them.
Legendary actress Lillian Dube is part of CancerVive's survivor team, having been through the breast cancer ordeal herself just a few years ago.
I was diagnosed in 2007 when I was 63 with breast cancer. And guess what? I did my own self-breast examination. And because I used to go for my yearly mammograms, I went straight for my mammograms and that's when they picked it up. It is so important in that if it was my first time going for mammogram, they still could not have picked it up. But they had my previous x-rays to compare with.